You probably write it off as just being tired or stressed. But what if that constant brain fog, that weird tingling in your hands and feet, or that deep, unshakable exhaustion is actually your body trying to tell you something important? These common feelings, the ones we so often brush off as a normal part of a busy life, could be the early signs of a vitamin B12 deficiency. Ignoring them might feel easy right now, but it can lead to serious and sometimes permanent neurological damage. We are about to reveal both the everyday signs you might be overlooking and the more shocking neurological symptoms you absolutely cannot ignore. What you learn in the next few minutes could be the key to reclaiming your energy, your clarity, and your health. So, what exactly is this vitamin that holds so much power over our well-being? Vitamin B12, also called cobalamin, isn't just another nutrient on a long list. It's a non-negotiable part of a healthy life. Think of it as a master key for your body, unlocking several critical functions. First, vitamin B12 is absolutely essential for making healthy red blood cells. These are the tireless delivery drivers that carry oxygen from your lungs to every single cell in your body, from your brain to the tips of your toes. Without enough B12, this production line sputters, with consequences we'll get into shortly. Second, B12 is a key player in creating and maintaining your DNA, the very blueprint of life. Every time a cell divides, it needs a perfect copy of its DNA, and B12 is there, making sure the process goes off without a hitch. When it's in short supply, this can cause problems in tissues that regenerate quickly, like those in your mouth and gut. And third, perhaps most critically for our chat today, is its role in your nervous system. Vitamin B12 is responsible for maintaining the health of something called the myelin sheath. The easiest way to picture the myelin sheath is as the protective insulation around an electrical wire. This coating allows nerve signals to travel lightning fast through your brain and body. When this insulation gets frayed because of low B12, those electrical signals can slow down, get scrambled, or stop altogether, leading to a whole cascade of neurological issues. Despite its importance, B12 deficiency is surprisingly common and often tragically missed. Its symptoms are masters of disguise, mimicking the signs of aging, stress, or a dozen other conditions. You might be told you are just overworked when your body is actually crying out for this critical nutrient. This video is all about giving you the knowledge you need. We've compiled research from authoritative medical sources to give you a clear, comprehensive guide. We'll walk through the symptoms, starting with the common signs linked to anemia and moving into the scarier neurological issues that demand immediate attention. Then, we'll break down who is most at risk and why. Most importantly, we'll finish with a clear action plan. What to do about it, how to talk to your doctor, and what the path to recovery looks like. Stay with us, because understanding these signs is the first step to taking back control of your health. The common, systemic symptoms. Let's start with the symptoms that pop up most often, the ones tied to how a B12 deficiency messes with your blood. These are the signs that can sneak up on you until they start making daily life feel like a real struggle. Pervasive, bone-deep fatigue and weakness. The number one most widespread symptom of a vitamin B12 deficiency is a profound and relentless fatigue. This isn't your typical, "I need more coffee" tiredness. This is a deep, cellular exhaustion that settles into your bones and just won't leave, no matter how much you rest. People often describe it as feeling like they're moving through mud, where every little thing requires a huge effort. So why does this happen? It's directly tied to B12's job in making red blood cells. To produce healthy, effective red blood cells, your body needs B12. Without it, their development in your bone marrow gets messed up. They become abnormally large and immature, a condition known as megaloblastic anemia. These oversized, misfit cells, called megaloblasts, are not only fewer in number but are also terrible at their main job, carrying oxygen. Since your tissues and organs aren't getting enough oxygen, your body simply can't produce the energy it needs. It's a full-blown energy crisis, all because of a shortage of this one vitamin. Pale or yellowish skin, jaundice. Ever look in the mirror and notice your skin has lost its healthy glow? Maybe you look unusually pale, or people keep asking if you're feeling okay. This change can be another telltale sign of a B12 deficiency. The paleness is a direct result of the anemia we just talked about. Fewer red blood cells mean less red pigment circulating under your skin, giving you that washed-out look. But it can go beyond just being pale. In some cases, the skin and the whites of the eyes can take on a yellowish tint. This is a sign of jaundice. This happens because those fragile, poorly formed red blood cells break down more easily. When they get destroyed, they release a yellow pigment called bilirubin. Usually your liver is great at clearing bilirubin out. But when there's a mass breakdown of red blood cells, the liver can't keep up. The bilirubin builds up in your blood and gets deposited in your skin and eyes, giving them that yellow hue. So if your skin tone seems off, it's a big clue that your body might be struggling. Shortness of breath and heart palpitations. Do you get winded from simple things like climbing a flight of stairs or carrying in the groceries? Or maybe you've felt your heart pounding or skipping beats for no good reason. These alarming feelings are also classic symptoms tied to B12 deficiency anemia. Once you understand the problem, the reason makes perfect sense. Your body is running low on oxygen because you don't have enough effective red blood cells. In response, your survival instincts kick in. Your lungs make you breathe faster to try and pull in more oxygen. That's the shortness of breath. At the same time, your heart goes into overdrive, beating faster to pump what little oxygen-carrying blood you have around your body more quickly. This is what you feel as heart palpitations. It's your body working double time, desperately trying to deliver the oxygen your vital organs need. A sore, red, smooth tongue, glossitis, and mouth ulcers. One of the weirdest and most specific signs of a B12 deficiency can be found right in your mouth. You might get a sore, red, and strangely smooth tongue, a condition called atrophic glossitis. It can feel painful or beefy, and you might find that spicy or acidic foods suddenly become your mortal enemy. Along with this, you might get slammed with recurrent mouth ulcers. The reason this happens comes back to B12's role in cell division. The cells on the surface of your tongue, including the little bumps called papillae, are constantly regenerating. When B12 is low, this rapid renewal process gets broken. The papillae can shrink and disappear, leaving your tongue's surface smooth, shiny, and inflamed. This same issue affects the delicate lining of your whole mouth, making it prone to painful ulcers. So, if your tongue is sending out an SOS, don't just write it off. It could be a very clear sign of a deeper problem. The shocking neurological symptoms. Now we get to the neurological symptoms. This is where a vitamin B12 deficiency shifts from being a problem to being genuinely dangerous, as some of this nerve damage can be permanent if it's not caught in time. These are the signs you can never, ever ignore. Brain fog, memory problems, and cognitive decline. Ever feel like your brain is wrapped in cotton? You can't focus. Simple tasks feel huge. You can't find the right words, and your memory feels frustratingly fuzzy. This brain fog is a very real and distressing symptom of B12 deficiency. While some of it is due to less oxygen getting to the brain, it's now understood to be a direct neurological symptom as well. B12 is a vital team player in making neurotransmitters, the chemical messengers your brain cells use to talk to each other. A deficiency can throw this delicate chemical balance into chaos, leading to slow thinking, confusion, and memory lapses. In older adults, these symptoms can be tragically misdiagnosed as early signs of dementia when they might actually be caused by a treatable vitamin deficiency. Strange sensations, pins and needles, paresthesia. This is probably the most classic neurological sign of a B12 deficiency, that pins and needles sensation. medically known as paresthesia. It often starts in the hands and feet as a strange tingling, numbness, or a burning feeling that has no obvious cause. It's the sensation of a limb falling asleep, but it happens without any pressure and can stick around. This symptom points us directly back to the myelin sheath, that protective insulation around your nerves. Vitamin B12 is essential for maintaining this coating. When B12 levels are low, this protective layer starts to break down in a process called demyelination. Without proper insulation, the nerve's electrical signals become chaotic. They might fire randomly or fail to send signals at all. This nerve signal chaos is what you feel as tingling or numbness, a direct warning that your nervous system is taking damage. Problems with balance and coordination, ataxia. As the neurological damage from B12 deficiency gets worse, it can start to mess with your movement. You might find yourself feeling clumsy, stumbling more, or unsteady on your feet. This difficulty with balance and walking is known as ataxia. It can get so bad that you might need to hold on to walls for support. This scary symptom is caused by damage to specific pathways in your spinal cord. B12 deficiency can lead to something called subacute combined degeneration of the spinal cord, which affects the parts of the cord responsible for proprioception, your body's built-in GPS for knowing where it is in space. When the myelin around these nerves is damaged, that feedback loop is broken. Your brain is essentially flying blind, not getting the right information from your feet and legs to keep you balanced. This is why someone with advanced B12 deficiency might have an unsteady walk. Similar to someone who is intoxicated, it's a very serious sign. Vision disturbances. You might not connect your eyesight with a vitamin, but B12 is crucial for healthy vision. A deficiency can show up as blurred or double vision, shadows, or just a general decline in your sight that glasses can't fix. The culprit, once again, is demyelination. The optic nerve, which is basically a thick cable connecting your eye to your brain, is also covered in myelin. Just like the nerves in your hands and feet, the optic nerve is vulnerable when B12 is scarce. Damage to this nerve, called optic neuropathy, disrupts the visual information traveling to your brain, leading to distorted vision. While it's not the most common symptom, it is a documented and serious consequence of an untreated deficiency. Mood changes, depression, anxiety, and irritability. The neurological impact of B12 deficiency also hits our mental and emotional health hard. A lack of this vitamin can lead to major mood problems, including depression that doesn't seem to have an external cause, high anxiety, and constant irritability. In very severe cases, it can even cause psychosis and hallucinations. There are two main reasons for this. First, as we mentioned with brain fog, B12 is needed to produce mood-regulating brain chemicals like serotonin and dopamine. An imbalance of these is a known cause of depression and anxiety. Second, B12 is involved in cleaning up a potentially harmful amino acid called homocysteine. When B12 is low, homocysteine levels can build up in the blood. High homocysteine is a known risk factor for depression and cognitive decline. These mood changes aren't just in your head, they are a direct physiological result of a nutrient deficiency. The critical warning, neurological symptoms without anemia. This last point isn't a symptom itself, but it's the most important piece of information here. It is absolutely critical to understand this. You can have severe progressive neurological symptoms from a B12 deficiency even when your standard blood tests show you are not anemic. This is a trap that patients and even some doctors can fall into. Many practitioners are trained to connect B12 deficiency mainly with anemia. If the red blood cell count looks normal, they might rule out B12 deficiency. However, a huge amount of clinical evidence shows that neurological damage can happen long before any signs appear in the blood, sometimes by years. Your body seems to prioritize its limited B12 to keep making red blood cells, while the nervous system is slowly starved. This means you could be suffering from tingling, balance problems, and brain fog, yet be told your blood work is fine. This is the most dangerous scenario because the window to prevent permanent nerve damage can be missed. Causes and who is most at risk. Now that you know the signs, the next question is, why does this happen and am I at risk? A B12 deficiency can pop up for a few different reasons. Category 1. Dietary insufficiency. This is the most straightforward cause. Vitamin B12 is made by microorganisms and is found almost exclusively in animal-based foods like meat, fish, eggs, and dairy. Because of this, people following strict vegetarian or vegan diets are at a very high risk of deficiency if they don't supplement. While some plant-based foods like nutritional yeast and fortified cereals have B12, it can be tough to get enough from these alone. For anyone on a plant-based diet, supplementing with B12 isn't just a good idea, it's essential. Category 2. Malabsorption issues. This is by far the most common reason for B12 deficiency, especially in older adults. Malabsorption means that even if you're eating plenty of B12, your body can't absorb it. Here's why that can happen. Age-related decline in stomach acid. As we get older, many of us produce less stomach acid. This is a problem because acid is needed to cut B12 loose from the protein it's attached to in food. Not enough acid means the B12 never gets freed to be absorbed later. Pernicious anemia. This is a common autoimmune cause of severe B12 deficiency. In this condition, your immune system mistakenly attacks cells in your stomach that produce a protein called intrinsic factor. Think of intrinsic factor as a VIP escort for B12. It has to bind to B12 for it to be absorbed. Without this escort, the B12 just passes right through you. Gastrointestinal surgery. Procedures like gastric bypass or surgeries that remove parts of the stomach or small intestine can remove the exact sites where B12 is processed and absorbed. Digestive diseases. Conditions like Crohn's disease or celiac disease cause chronic inflammation that can damage the lining of the small intestine and wreck its ability to absorb B12. Category 3. Medications. Certain common medications, when taken long-term, are known to interfere with B12 absorption. Acid reflux meds, PPIs, and H2 blockers. Medications like omeprazole, pantoprazole, and ranitidine work by reducing stomach acid. While they bring relief from heartburn, long-term use can block B12 absorption, just like age-related acid decline does. Metformin. This is a frontline drug for type 2 diabetes. It's well known that long-term use of metformin can interfere with B12 absorption in the small intestine. Anyone taking metformin should have their B12 levels checked regularly. Category 4. Other lifestyle and genetic factors. Chronic alcohol use. Heavy drinking can damage the stomach lining, hurting nutrient absorption. Genetic factors. Rare genetic mutations can affect how the body processes B vitamins, increasing the amount you need. Section 4. The solution. Your action plan. Okay, so you know the symptoms and the risks, but knowledge is only powerful if you do something with it. If any of this is ringing a bell for you, it's time to make a plan. Remember, this is for informational purposes only and is not medical advice. Use these steps to work with a healthcare professional. Step 1. Talk to your doctor and advocate for proper testing. This is the most important step. Don't self-diagnose. Make an appointment and be specific about your symptoms. The fatigue, the brain fog, the tingling, all of it. Mention your risk factors like your diet, age, or medications. When it comes to testing, being an informed patient is key. The standard test is a serum vitamin B12 level. However, this test can be misleading. Levels in the low normal range, e.g. between 200 and 400 pg/nml, can still cause serious neurological symptoms. To get the full picture, you should ask your doctor about 2 more sensitive tests. Methylmalonic acid, MMA. This substance builds up in your body when there is not enough B12 to process it. An elevated MMA level is a very strong indicator of a B12 deficiency, even if your serum B12 looks normal. Homocysteine. This amino acid also rises when B12 is low. It's less specific than MMA, but having both an elevated MMA and homocysteine is powerful evidence of a B12 deficiency. Advocating for this more detailed detective work can be the key to getting the right diagnosis. Step 2. Discuss treatment options with your doctor. If a deficiency is confirmed, the goal is to get your B12 levels back up. The right treatment depends on the cause. Vitamin B12 injections. This is the gold standard, especially for malabsorption problems like pernicious anemia. Injections bypass the digestive system completely, delivering B12 straight to your muscle. Treatment often starts with frequent loading doses, followed by maintenance shots for life. High-dose oral or sublingual supplements. For deficiencies caused by diet, high-dose oral supplements, usually 1,000–2,000 mcg daily, can work great. Interestingly, studies show that even with malabsorption, taking a huge oral dose can sometimes be enough to overcome the problem over time. Step 3. Make supportive dietary adjustments. While treatment is key to fixing a deficiency, your diet is your best supporting actor. If you eat animal products, focus on consistently eating B12-rich foods. Great sources include liver, clams, sardines, beef, salmon, eggs, and dairy. If you are vegan or vegetarian, as we've stressed, a reliable supplement is non-negotiable. Don't leave it to chance. Choose a quality B12 supplement and make it a daily habit. Fortified foods are a good backup, but don't count on them as your primary source. If you found this information valuable, and you know someone who's struggling with unexplained fatigue or brain fog, please do them a favor and share this video. You might just give them the missing piece of their health puzzle. And to keep learning how to be your own best health advocate, make sure to subscribe and ring the notification bell so you don't miss what's next. We'd love to hear from you in the comments. Have you ever dealt with these symptoms? Have you been diagnosed with a B12 deficiency? Sharing your story helps build a community and can make a world of difference to someone feeling alone on their health journey. The main message today is simple but profound. Don't dismiss your symptoms. That crushing fatigue, those strange sensations, the fog in your mind. These are not just things you have to live with because you're stressed or getting older. They are signals. Your body is constantly communicating with you, and a B12 deficiency is one of its loudest cries for help. By understanding the full range of symptoms, knowing the risks, and knowing what to do, you're no longer in the dark. You are empowered. Learning to listen to your body is the most powerful step you can take toward lifelong health. Take this information, be your own health advocate, and work with your doctor. Never stop searching for the answers that will let you live with the energy and vitality you deserve.